Hi, I'm Dutch Ross. I'm the founder of Everyone Health. Yes, healthcare is broken. If you look on Twitter, LinkedIn, you read anything at all, you know that our healthcare system is absolutely horrendous. 99.9% of patients can't get what they need. Doctors complain all day long. Government bureaucrats don't know how to solve the problem except to be political. At Everyone Health, we know exactly how to solve this problem. We are today helping more self-funded employers than any other company in the country to reduce, stabilize, and hedge their medical expenses. Now, what does that mean to you? Well, it means that we've bypassed the commercial carriers. They're really known as the BUCAs, Blue Cross, United, Cigna, and Aetna. And what they've done is, over the last 100 years, they've partnered with the large health systems. The large health systems include university systems such as Atrium, or the University of Virginia, or UCLA, or Banner Health, Mount Sinai, NYU. The list goes on and on. And what they've done is they've taken from the American people. We pay on average 5 times more than the next industrialized country. Now here's where that's not true. Our agreements are directly with the physicians and the facilities that they own. Now in 2011 we passed a law that is somewhat contentious. But one of the things that I did not like about the law is that it made it so that physicians could not have ownership in hospitals anymore. So bankers can have ownership, private equity can have ownership, even venture capitalists can have ownership, but doctors, we don't want them to have ownership in any hospitals. That would be terrible. So what we did was we said, well, let's find surgical hospitals, ambulatory surgery centers, and practices that are owned by physicians who can make their own decision and do what's best for the patient. And what they've done is an absolute miracle. These physicians, there's about 8,000 of them, have given us prices and said, go out into all the world and help employers, help consumers. And so what we're doing today is we're providing transparent, all-in bundled prices. And what that means is that just like when you buy a pencil, just like when you buy a piece of clothing, you know exactly what you're paying for and you know that it's included, right? Like, it's super easy. So we deliver it to members in the form of an app you can easily download from anywhere, and we make it so that prices are transparent. Now somebody will say, well, now how does that actually help an employee? Well, here are the facts. The prices that we've contracted on are somewhere between 30 to 70% less than what the BUCAs and the health systems have charged. So what does this mean for an employer? It generally means that they can take 30% of the money they were spending on healthcare, sometimes it's 50%, sometimes it's 70%, and they can allocate that money even better. So do you want to hire new employees? Yes. Do you want to invest in R&D? Yes. Do you want to give out bonuses? Yes. Or do you just not want to overpay? See, I'm just annoyed by overpaying. I don't want to pay more for something that shouldn't be more expensive.